Antenatal Screening. During your pregnancy, you will be offered a variety of screening tests. These tests help us to understand your body and your baby and can help you to make choices about your maternity journey. It can sometimes feel overwhelming when multiple screening programs are offered to you, but your maternity team are there to help you understand these tests so that you can choose which ones to accept. All pregnant women and people are offered a series of blood tests. These are done to find out your blood group, to rule out some infections, and to ensure your blood count is normal. It's very useful when providing your care to be aware of the results of these tests, so that we can offer further treatment and preventative measures when necessary. Chromosomal abnormalities. You will also be offered a screening test for 3 chromosomal abnormalities. These are Downs, Edwards, and Patau's syndrome. These are genetic and cannot be cured, but for some people, knowing there may be a condition helps them to prepare or make decisions about whether they wish to continue with their pregnancy. It is important to understand that the initial screening test will not give you any definite answers. What it will do is provide you with the information about your chances of having each syndrome. This is calculated by taking an extra measurement of the baby during your first scan. We will then ask to take a further blood test from you. The combined results of these will generate a chance for the 3 syndromes. You will need time to discuss with your family how you would feel if your result was a higher chance. Any results will be given to you individually with an appointment to explore further options. There are tests that can make a diagnosis, but these carry their own risks and will be discussed with you by a specialist team to give you the information you need to make the right decision for you and your family. Ultrasound scan. Further screening is offered to you with a second scan at around your 20th week of pregnancy. This scan will look at your entire baby, including all of their organs, how much water is around the baby, and where your placenta is. It's sometimes possible to see the gender of your baby at this time, but not always. If all is well at this scan, this will be the last scan you will have. Growth monitoring. As your pregnancy progresses, the maternity team will continue to screen you at each appointment by offering to measure your blood pressure, test a urine sample, and measure your baby's growth. Your baby's growth is usually monitored by measuring your tummy with a tape measure. If you require further scans, your maternity team will explain the reasons for this. With so much to think about and so many decisions to make, screening choices in pregnancy can feel overwhelming. If there are moments where you feel you need further information, need time to think, or wish to have a discussion about something, please talk to your midwife. Your maternity team will be happy to explore your options with you to help you decide what is best for you and your family. To find out more, visit sneewellbeing.org.uk/maternity.